My name is Mark Trouville. I'm the DEA Special Agent in charge of the Miami Field Division. Well, the problem in Florida is very severe with prescription drug abuse. Right now we're seeing approximately 7 people a day die in the state of Florida from abusing prescription drug abuse. Information from the CDC indicates that teenagers between the ages of 12 and 17 are abusing pharmaceutical drugs more than cocaine, heroin, and methamphetamine combined. We have a situation here in Florida where out of the top 100 orders of oxycodone, doctors ordering oxycodone, approximately 98 of them, 97 of them are here in Florida. We have a situation where, again, 90% of all the oxycodone in the United States is being ordered by healthcare professionals here in Florida. Well, there are a number of issues. One of the concerns in Florida is a lack of the prescription drug monitoring program, which exists in most of the other states, especially the states where we're finding folks coming here in Florida to get their prescription drugs. Of course, Florida has always had a very large medical community down here. There's a lot of elderly, and the medical community is very large down here, so there's certainly an abundant number of healthcare professionals in the area, and it's a large metropolitan area. DEA's Operation Pill Nation is an ongoing operation. We conducted one phase of the investigation where we actually made approximately 300 undercover buys in a large number of pain clinics, or pill mills as we call them. It's a 3-pronged strategy DEA has to go after the clinic owners, doctors, and the people who work there who are working in these pill mills simply for profit and greed and have no concern for the greater good or medical practices here in Florida. This is ongoing. We continue on. We will continue this operation while we have illegal pill mills here in Florida. The first thing that's important to understand is DEA has never and will not target doctors. We target drug traffickers. We're targeting people who are putting on the air of medical professionals and really simply slinging dope out onto the streets. One of the tools that we use, as we talked about, is called the ARCOS database, in which we were able to find out how many oxycodone pills, for example, are being ordered by doctors into South Florida or into the state of Florida. And we can see that a number of these doctors working in these clinics are ordering tremendous amounts of oxycodone, completely out of whack with what they should be ordering and what they would be prescribing in legitimate medical practice. Once we understand that and we understand where the oxycodone is being ordered from, we can take a look at these clinics and see if they're operating properly. And a great majority of the time they are not. And we will do undercover work, we will do investigative work. And look, this is a whole lot of common sense involved in this thing. And people that wonder about these pill mills simply have to ask themselves what makes sense to them. If a person goes to see their doctor, do they expect to see an armed guard in the waiting room or in the parking lot? Do they expect to see 50, 75 people waiting for an hour for the door to open and then crowding into the clinic? Do they expect to see people sleeping in their cars in the parking lots, in cars that come from tags of Tennessee and Ohio and West Virginia and Massachusetts? Does that make any sense to people that are going into a legitimate medical practice? And we see these things every day. And this is the problem we're dealing with these clinics. And these clinics are not about the public good. They're not about individual health. They're all about profit and greed and making money. If a legitimate medical doctor was seeing this, first of all, a legitimate medical doctor that walked into one of these clinics would be appalled and would immediately know what this is. And if a legitimate medical doctor did see this and they wanted to report it, calling DEA would be an absolute outstanding idea. They could call the local police, but DEA would certainly respond to that. Well, certainly emergency room data is available. I don't have that in front of me right now. But the statistics are very clear when we know that 7 people are dying from overdoses of prescription drug abuse every day in the state of Florida. And if you just look at the raw numbers on the tremendous amount of oxycodone pills, for example, that are being ordered by doctors in Florida and then being sent out through the doors of these clinics, you can see the relationship why so many people are dying from overdose. The problem we have is with a lot of, especially younger people, confuse these things. They think it's safe. Because it's medicine, young folks consider it safe. What we have an example here is we have good medicine. Oxycodone is a good medicine. But we have a case of good medicine and bad behavior. People are abusing these things. When used properly and prescribed properly, it's a good medicine. It's part of our medical practice. But when it's abused, and it's abused too much now, it becomes deadly. No, we're not really seeing that per se. What we are seeing more of a cocktail is these pain clinics will prescribe oxycodone and Xanax, both being depressants and both having a synergistic effect on each other. That's kind of what we're seeing as the cocktail. I would like to emphasize, I know this is a medical channel, that DEA does not target doctors. We never have, we never will. And again, I would say, using the common sense test, if you took a doctor, any doctor that in my words is a real doctor, and had them walk into one of these pain clinics, they would be appalled and they would be shocked and they would want something done. This is a situation where the word medical is just a cover for these people, and they're simply dope dealers, and we're not standing for that.